Okay, we go to the 5 transporting points. Ying Spring Points, bladder 66, foot connecting valley. Location, at the lateral border of the foot in the depression distal to the metatarsophalangeal joint of the little toe. How to find? When palpating along the border of the red and white skin on the lateral aspect of the foot at approximately the midpoint of the length of the foot, a clearly defined bony structure can be felt. This is the tuberosity of the fifth metatarsal bone. Distal to it, towards the toes, you can feel a further prominent bony structure, the head of the fifth metatarsal bone, or the fifth metatarsophalangeal joint. Bladder 66 is located directly distal to it. In the depression at the junction of the base and the shaft of the proximal phalanx of the little toe. Bladder 65 is located proximal to the head of the fifth metatarsal bone. Spleen 2 is located in a comparable position on the medial aspect of the foot. Located in a comparable position on the hand are SI2 on the ulnar aspect and LI2 on the radial aspect. Needling, vertically 0.3, 0.5 June. Caution, painful point. Actions, indications, clears the head, descends the lung and stomach chi, comes the Xiyan. Special features, Ying Spring Point, Water Point, Bend Point, 5-phase point. Like all the spring points, bladder 66 clears heat and is particularly useful to clear bladder heat in acute cases of cystitis, as it is the more dynamic and powerful than other bladder points in its clearing heat action. It also clears heat from the bladder channel, especially in relation to the eyes and nose. Bladder 66 can stimulate the rising of clear chi to the head to dispel dampness in the head that is causing a feeling of heaviness and mussiness of the head. Clears heat, difficult urination, burning pain on urination, scanty dark urine, redness of eyes, nosebleed. It also promotes the rising of clear chi to the head, feeling of heaviness of the head, dizziness. Bladder 66 is the water point of the bladder water channel. Like all the distal points of the bladder channel, its principal action is to clear pathologically ascending chi and yang from the head. This was emphasized in spiritual pivot, which states when chaotic chi is in the head, select bladder 10 and bladder 11. If needling this fails to work, select the spring and string points of the foot tai yang. That is the bladder 65 and bladder 66. If chaotic chi affects not only the head, but also impairs the descending function of the lungs and stomach, the consequent rebellion of chi will give rise to coughing, dyspnea, fullness of the chest, and vomiting. As the water point on a water meridian, ZUTONGGU captures the essence of water and can be used when there is fear, lack of will, or sore joints, as well as to calm and reassure the spirit of water that will endure. Used as a horary point, you can gain maximum effect when reserves and the quality of water needs to be called upon. The constant vigilance of the bladder official, especially when out of balance and prone to agitation, dread, or exaggeration, can be exhausting for body, mind, and spirit. Penetrating valley promises the quite forceful calm of the bladder official, taking a moment of repose and refreshment before continuing its journey. Kidney 10 in Bali shares a similar quality. Balis have a protected feel, and the way it's already formed, so excessive effort is not required. When the chi has become chaotic, it may become rebellious, This point sinks the qi to restore the correct movement of qi in the body. Here, the dynamic warrior aspect of water can ease into a more yin, quite contemplative mode. It deeply refreshes, soothes, and cleanses the spirit of the bladder. As a yin spring point, it will clear heat from the bladder. This effect is enhanced as the water point on a water meridian. As a yin spring point, it is a dynamic point that will move qi through the meridian and clear obstructions, ease painful joints, and clear heat from the skin. Used in the early stages of wind heat with fever, stiff neck, and headache. Clears heat and yang from the head, removes obstruction from the meridian, eliminates wind. Water point, horary point, which is 3 to 5 p.m., seasonal horary point, winter, yin spring, antique spring point. As the water point, it shakes up and invigorates the bladder official. Consider for fear of the unknown, blurred vision, or where the way forward is not clear. Refreshes the mind and spirit. Consider when a person is rigid with fear, has stiff joints, and unable to flow. Useful for reaching to the deeper level of the patient. Calms, reassures, and captures the essence of the water official. This point can help clear obstruction within a person as they progress via the protection of this valley on their onward journey in life. Thank you for your attention.
Now let's discuss liver 3, TAICHONG, great rushing, a shoestring point. Located on the dorsum of the foot between the first and second metatarsal bones, in the depression proximal to the metatarsophalangeal joints, and the proximal angle between the two bones. How to find liver 3? From the web margin between the first and second toes, palpate proximally past the metatarsophalangeal joints and along the groove between the first and second metatarsal bones until you reach the widest and deepest part of the groove. There, locate liver 3, which is often sensitive to pressure. To double-check, when continuing to palpate along the groove, it will become more narrow and shallow again. Located in a similar position on the hand is LI4, between the first and second metacarpal bones. Needling vertically or slightly obliquely 0.5 to 1 soon. Caution during pregnancy. Actions, indications, liver 3 spreads liver qi, clears head, benefits the eyes, nourishes liver blood and liver yin, calms spasms, alleviates pain, regulates menstruation and the lower burner, eliminates internal wind, pacifies liver yang. Special features, Yuan-source point, shoestring point, earth point, mud and yang heavenly star point, later added by Shu Feng, major point for spreading liver qi. Liver 3 is the shoestring and Yuan-source point of the liver channel. The spiritual pivot in chapter 6 recommends the use of the shoestring points in disorders of the Zhang, whilst in chapter 1 it says when the 5 Zhang are deceased, select from the 12 Yuan-source points. Liver 3 is arguably the most important point of the liver channel, with an extensive range of actions and may be used with equal effect for both excess and deficiency patterns of the liver Zhang and its channel. So important did the Ming Dynasty physician Shu Feng consider liver 3 to be that he added it to Madan Yang's 11 heavenly star points when listing them in his work Complete Collection of Acupuncture and Moxibustion. Since this time, these points have become known as Madan Yang's 12 heavenly star points. Master Zhu Tonggu in the 14th century said, "The liver governs spreading and draining, and when the qi and blood flow harmoniously, the 10,000 diseases will not arise. Once there is constraint, all diseases may arise." The liver's function of spreading means that although the liver is not considered responsible for the production of qi, it ensures that the flow of qi in the body remains free, easy, open, relaxed, and unobstructed. This function may be impaired in 3 main ways. Firstly, and most commonly, it may develop when the spontaneous expression of any of the emotions is restricted, especially anger. Secondly, the spreading function of the liver is an expression of its yang qi, and a saying of Chinese medicine stresses, the body of the liver is yin, whilst its function is yang. In other words, the liver yang is dependent on liver yin. Stagnation of liver qi may therefore result from failure of yin or blood to moisten, nourish, and soften the liver. Thirdly, the ability of the liver to spread qi may be obstructed by the presence of pathogenic damp heat. A full understanding of liver disharmony also stresses one further point, which is that liver qi stagnation may bring about the development of any other liver pattern. For example, by transformation into liver fire, the consequent consumption of yin, and hence the uprising of liver yang. Or by transformation of either liver fire or liver yang into wind. For this reason, it is said that clinically any pattern of disharmony of the liver may be accompanied by qi stagnation. Being the shoestring point, it can affect the zang, and so can be used for all disorders of the liver. Shoestring points can be used both to tonify and disperse. Supreme rushing expels wind and calms spasms, contractions, and cramps. Wood governs the sinews and tendons. It can be combined with Li4 to expel wind from the face in Bell's palsy, facial paralysis, and tic. It is used to expel painful obstruction syndrome where wind is the dominant factor. Used to subdue liver yang rising, for example, in migraine. Source point, earth point, shoestring, antique, summer point. It is also a total relaxation point, Madan Yang heavenly star point, Shokantan point, independent point for spasms. This important and frequently used point is indicated for many conditions. It is particularly effective when sedated for a person who is tense, overexcited, easily angered or annoyed, agitated, or tightly wired. It brings calm and balance to the system. It can be combined with Li4 to accentuate this calming effect and help eliminate toxins on both the mental and physical levels. When tonified, it can bring a great surge of energy to the meridian. Its alternative name of happy calm describes its effect well. Consider for painful or irregular menstruation. Thank you for your attention.
Let's continue with the extra points. Shixuan, 10 diffusion, EX, upper extremity 11, and Xiyan, eyes of the knee, EX, lower extremity 5. Location on the tips of the 10 fingers. How to find? These 10 points are located on the tips of the 10 fingers, approximately 0.5 June from the free margin of the fingernail. Located in a comparable position on the foot are the points of EX, LE, 12 on the tips of the 10 toes. Needling, prick to bleed. Actions and indication to expel pathogenic factors. These points are used in acute situations when the person is unconscious in cases of wind stroke. It clears heat in febrile disease, summer heat invasion. It extinguishes interior wind in wind stroke, clonic spasm, epilepsy. It opens the orifices and promotes resuscitation in those with loss of consciousness. Shixuan 10 declarations. The point MUE1 were first discussed in the 1,000 ducat formulas by the great 7th century physician Su Sim Miao. They are almost exclusively used for acute conditions such as loss of consciousness, including the acute phase of wind stroke, epilepsy, heat stroke, sunstroke, etc. They are usually prick to bleed, a procedure this may occasionally be followed by maximation. Eyes of the knee, Xiyan, EXLE5. How to find? This point is best located in the patient's knee, flexed, use knee support. The eyes of the knee can be located on the level of the lower border of the patella, lateral and medial to the patellar ligament. The lateral eye of the knee corresponds to stomach 35, the medial eye of the knee to EXLE4. Together, these 2 points form the extra point EXLE5, Xiyan. Needling, medial eye of the knee, 0.5 to 1 tune vertically or obliquely towards the lateral eye of the knee. Lateral eye of the knee, 0.5 to 1 tune vertically or obliquely towards the medial eye of the knee. Caution, do not needle too deeply to avoid extra articular puncture. These points corresponds to the incision site for knee arthroscopy. Actions, indications, it eliminate wind dampness, reduce swelling, and alleviate pain. Special features, important local points for disorders of the knee. These are important local points of the painful obstruction syndrome of the knees, especially when the pain is in the front of the knee or deep inside the joint. The needle should be inserted obliquely, slightly upwards, and medially towards the center of the joint to a depth of at least 0.25 tune. These points give particularly good results if moxa is burned on the needles. It expels wind damp, benefits the knees in swelling and pain of the knee, rigidity of the knee, weakness and numbness of the knee, painful obstruction syndrome, B syndrome of the knee. The Xiyan points were first discussed in the 8th century text, Necessities of a Frontier Official. Lateral Xiyan corresponds to stomach 35, while medial Xiyan is a non-channel point. Used together, these are essential points in the treatment of all knee disorders, whether due to deficiency or excess, heat or cold, or form the basis of any prescription for treating disorders of the knee joint and surrounding tissues. Thank you for your attention.
Let's talk about kidney 7, full Leo returning current at Jing River Point. Located 2 tune proximal to kidney 3 at the anterior border of the Achilles tendon. How to find kidney 7? First, locate kidney 3 on the level of the highest prominence of the medial malleolus in the depression between the malleolus and the Achilles tendon. From kidney 3, measure 2 tune in a proximal direction towards the knee joint and locate kidney 7 in a depression at the anterior border of the Achilles tendon. Located on the same level but more medially is kidney 8. 2 tune directly proximal to the medial malleolus. Needling vertically 0.5 to 1 tune. Actions, indications, regulates water passages and treats edema, strengthens the kidneys, especially kidney yang, drains dampness and clears damp heat. For disorders of the intestines due to damp heat, strengthens lumbar region. Special features, Jing River Point, Metal Point, tonification point. Kidney 7 tonifies the kidneys in a similar way to kidney 3, the only difference being that kidney 7 is better to tonify kidney yang. Kidney 7 is an important point to resolve dampness in the lower burner, causing urinary or intestinal symptoms, and to eliminate edema in the legs. It can either promote or stop sweating. It is frequently used in combination with Li4 to cause sweating in attacks of exterior wind cold, and with Heart 6 to stop sweating from kidney yin deficiency. To promote sweating, kidney 7 is reduced, while to stop sweating, it is reinforced. There is an ongoing debate as to whether kidney 7 tonifies kidney yang or kidney yin. Some argue the former, some the latter. It is better to tonify kidney yang. Its indications in eliminating edema would seem to support that as one needs to tonify yang to eliminate edema, a yin pathogenic factor. When using kidney 7 to tonify kidney yang, use moxa on the needle to strengthen its yang tonifying action. However, that does not mean that kidney 7 would aggravate a kidney yin deficiency. Indeed, among its classical indications, there is dry tongue and parched mouth. Acupuncture works differently than herbal medicine, and nearly every point can be used to tonify yang or yin depending on whether one uses moxa or not. REN4 is also a very good example of this. as it is an excellent yin tonic point. But with direct moxocones, it can tonify kidney yang. Kidney 7 tonifies the kidney, so good for backache, dizziness, tinnitus, weak knees, tiredness. Resolves dampness for diarrhea, abdominal fullness, mucus and blood in the stools, borborygmi, feeling of heaviness in the rectum. Opens the water passages of the lower burner and resolves edema. So for edema, difficult urination, retention of urine, painful urination, turbid urine, blood in the urine. Strengthens lower back, so good for backache, ache in the knees, cold knees. Regulates sweating, as in sweating and night sweating. According to the classic of difficulties, in cases of deficiency, reinforce the mother. In cases of excess, reduce the child. Kidney 7, the metal and hence mother point of the kidney water channel, is one of the foremost points to strengthen the kidney function of dominating body fluids and regulating urination and control sweating. Both the kidney primary and divergent channels ascend to the root of the tongue, and the spiritual pivot states that the Jing River point should be needled for changes manifesting in the patient's voice. Kidney 7, the Jing River point of the kidney channel, is indicated for dry tongue and parched mouth, dry tongue with stomach heat, curled tongue with inability to speak, propensity to anger with incessant talking, and propensity to laughter. As a tonification point, Kidney 7 supplements kidney qi, reestablishing the mother-child relationship along the Shang cycle and making this a nourishing point for the kidney. The metal element in its most positive state imparts vitality and abundance. Water is infused and animated by metal through inspiration. As a metal point, referred to in its alternative name deep-lying white, it enriches and imparts quality. This point might be selected when there is over-rigidity in water, or conversely, a lack of structure, so the goal of the qi or will is never achieved. In this way, it can strengthen the qi and support the person in overcoming fear and obstacles in their path. Metal point, tonification point, Jing River Antique Late Summer point, point used in the husband-wife treatment protocol, endocrine point. This point strengthens and invigorates kidney meridian, bringing energy from the mother to the child. As the metal point, it imparts quality and structure to this official, thus regulating the water passages. Returning current regulates the body's rhythms, for example, sleep, urination, or perspiration. Consider for foot weakness and paralysis, especially in children. You get no movement if the current is not returning. Also for male infertility, example, low sperm count, helpful for night sweats, together with heart 6. Thank you for your attention.
Now we go to the spleen channel, primary channel. Pathway, the external pathway of the spleen primary channel begins at spleen 1, on the big toe at the medial corner of the nail. This point is reached by a branch that separates from the stomach primary channel at stomach 42 foot yin-yang connection of the first great circuit. From spleen 1, the channel courses along the medial aspect of the foot, ascends anterior to the medial malleolus and continues along the posterior border of the medial aspect of the tibia, passes the anteromedial region of the knee and thigh, ascends the abdomen lateral to the midline to the second intercostal space, passing on its way to REN 3, REN 4, REN 10, GB24, liver 14. It curves downward again and terminates 6 June inferior to the axilla of the mid-axillary line at spleen 21. According to Solinas et al., its inner pathway branches off at REN 10 and enters the spleen, its pertaining Sang organ, and connects with the stomach, its paired Fu organ. From the stomach, an interior branch passes the diaphragm, ascends part of the esophagus, and enters the heart, where it connects with the heart primary channel, deep yin-yin connection. From spleen 20, a further branch ascends to the lung 1 at the level of the first intercostal space to form the hand-foot pairing yin axis of the first great circuit, Taiyin. The branch ascends further to the tongue, reaches the root of the tongue, and disperses on its lower surface. Clinical importance, exterior signs and symptoms, heavy sensation of the head and body, sensations of weakness in the legs, general fever, pain in the lower cheek, muscular atrophy and weakness of the legs and medial hip region, cold knees, feet and legs, edema, interior or sangpo organ signs and symptoms, abdominal pain, diarrhea or loose stools with undigested food, borborygmus, belching and dizziness, abdominal masses, loss of appetite, a sallow complexion, retention of urine, excess, spasm, foot pain, deficiency, abdominal fullness, borborygmus, diarrhea with undigested food. Connections and meeting points of the spleen primary channel. Connections with other channels, stomach primary channel, connections, foot yin-yang connection of the first great circuit. Location, stomach 42, spleen 1 on the foot. Circulation, circadian, according to the organ clock. Importance, interior-exterior relationship. Lung primary channel, connection, paired according to the 6-channel theory, hand-foot pairing, Taiyin, yin axis of the first great circuit. Location, spleen 20, lung 1 on the thorax. A branch of the spleen primary channel ascends from spleen 20 to lung 1. Circulation, non-circadian, not according to the organ clock. Importance, above-below relationship. Heart primary channel, connection, deep yin connection. Location, spleen, heart, on the thorax. An internal branch of the spleen primary channel spreads inside the heart and connects with the heart primary channels. Circulation, circadian, according to the organ clock. Importance, the heart primary channel receives nutritive chi from the spleen primary channel, first circulation of the yin chi. Connections with other sangpo organs, spleen, stomach, heart. The spleen channel starts from the tip of the big toe and runs along the medial aspect of the foot to ascend to the medial malleolus. It then follows the posterior aspect of the tibia, passes the knee and thigh to enter the abdomen. It enters the spleen and stomach, from where it ascends, traversing the diaphragm and reaching the esophagus. It ends at the center of the tongue. From the stomach, a branch goes through the diaphragm and links with the heart. Overview of the spleen points. Affects the inner aspect of the leg, abdomen, affects the uterus, affects blood, to stop bleeding, cool blood, invigorate blood, and nourish blood. It also nourishes spleen. Thank you for your attention.
Now let's go to location methods and tune measurements. And we will take up sacrum and sacroiliac joint. The sacrum. On the sacrum, landmarks for palpation are the median sacral crest and the sacral hiatus, as well as the sacral foramina on its lateral aspects. The sacral crest is formed by the narrow, irregular spinous processes, which can be palpated on the sacral midline. The sacral hiatus can be palpated as a U-shaped depression at the inferior end of the sacral crest. DU2 is located on the midline, just inferior to it. Both the sacral hiatus and the greater trochanter, the lower extremity, are reference points for locating gallbladder 30. The sacral foramina are located between the lumbosacral joint and the sacral hiatus and can usually be palpated. They are in most cases evenly spaced and lie approximately 1 finger width lateral to the midline, with the distance decreasing in a distal direction. The foramina are the location of bladder 31 to bladder 34. The iliosacral joint can be palpated bilaterally as a shallow groove between the sacrum, the pieces, and more inferiorly located ilial structures. Bladder 26 to bladder 29 are located in this area. Thank you for your attention.
Let's discuss the window of heaven points, DU16, Fu, Palace of Wind. Location on the posterior midline directly below the external occipital protuberance, in the depression between the origins of the trapezius muscle. How to find? The external occipital protuberance is a hump-shaped projection on the posterior surface of the occipital bone on the midline slightly superior to the craniocervical junction. Locate DU16 in a depression on the posterior midline that can be palpated directly inferior to the protuberance and between two origins of the trapezius muscle. Generally, DU16 is located approximately 1 tune superior to the posterior hairline. GB20 is located on the same level below the occiput in a depression between the origins of the trapezius and its sternocleidomastoid muscle. Needling 0.5 to 1 tune slightly obliquely in an inferior direction. Bend the patient's head slightly forward when needling. Caution, dangerous point with deep needling. No stimulation. Strictly no needling in a superior direction. Danger of puncturing the cerebellomedullary cistern. Also cite for suboccipital puncture. The needle should be inserted into the nuchal ligament. According to some authors, moxibustion is contraindicated. Actions, indications, dispel external wind, calms internal wind, and the Xiyan. Nourishes the sea of marrow, lightens the Xiyan. Special features, meeting point with Yang Wei Mai, and according to some authors, the Yang Kiao Mai, sea of marrow point, window of heaven point, Susin Miao ghost point, used for all disorders which are caused by external or internal wind and which are characterized by sudden onset, changing location, and or intensity of the disorder, involuntary movements. DU16 eliminates both exterior and interior wind. It can therefore be used for exterior attacks of wind, cold, or wind heat, as well as for patterns of interior wind, such as wind stroke, epilepsy, or severe giddiness. Its capacity in eliminating wind in general makes it a very important point to relieve headaches from liver yang rising, liver wind, liver fire, and acute headaches from exterior wind. Its action in treating headaches is also partly due to these points being a point of the eye system which emerges from the brain at DU16. DU16 is a point of the sea of marrow. Marrow fills up the brain, and this point can clear the mind and stimulate the brain. It also extinguishes interior wind in epistotonus, aphasia from windstroke hemiplegia. Expels exterior wind in aversion to cold, fever, body aches, occipital stiffness, and headaches. Nourishes marrow and benefits the brain in headache, dizziness, tinnitus, blurred vision. It also calms the mind and opens the mind's orifices in manic behavior, desire to commit suicide, sadness, fear. Finally, DU16 is one of 10 points listed in Chapter 2 of the Spiritual Pivot that have come to be known as Window of Heaven points. It shares with the other points of this group the ability to treat headache and dizziness, descends rebellious chi in vomiting, treats throat disorders, benefits the sense organ, the eyes, nose, and tongue, and treats sudden onset of disorders in sudden inability to speak following windstroke, sudden loss of voice. Window of the sky, point of sea of marrow, ghost point, crossing point of Dumai and Yang Wei Mai, linking vessel. This point is effective in treating the patient at the spirit level, can clear the head and bring perspective to their life and aid in the integration of body, mind, and spirit. Helps the patient to hear and see with enhanced clarity. As a sea of marrow point, in combination with DU15, 19, 20, DU16 can nourish the brain and the senses. This is a window of sky point. It is suggested that the practitioner consider treating window points on the CF first before using this point to gauge its response. Wind palace is particular name of the point conveys some of the benevolence of wind, its movement and ability to refresh. It is found here in a precious place, a palace of senses where a branch of Dumai enters the brain. This is a powerful point to reawaken and stimulate the sensory organ and motivate the spirit. All window of heaven points promote the free exchange of qi in the neck, bridge area. If there is a blockage of qi in this area, the body, mind, or spirit may be affected, causing symptoms of mental disturbance, problems affecting the sense organ, or disorders of the breath and digestion resulting from rebellious qi. This point might be chosen from someone's spirit regularly becomes deeply discouraged or feels embattled by life. They cannot sustain their spirit or keep motivated on their path. This yang point on the predominantly yang Dumai intensifies the freeing and brightening aspect of any window of the sky. It is potent point that can illuminate and restore a sense of rooted from expanded hope for a brighter future, as well as opening the window to allow the spirit to be present with a greater sense of connection to heavenly chi. Thankful wind palace, as well as the benevolent relationship with the wind, this area is vulnerable to attack by wind. It is a most useful point to clear pathogenic wind, whether from an internal or external cause. Windstroke epilepsy codes, a branch of doom, stimulate the yin of the sea of marrow and the sense organs. The alternative names, root of preoccupation and clear-headedness, indicate the possible use of this point to clear the frustrations of thoughts continually swirling about with no direction of resolution. Thank you for your attention.
We are starting on a new topic, constipation, and let's discuss the etiology. The term constipation is used to describe the slow movement of unduly firm contents through the large bowel, leading to infrequent passing of small hard stools. Thus, constipation may indicate several different signs, among which are bowel movements which do not occur daily, dry and or hard stools, difficult defecation, abnormal shape of stools. Views on what constitutes constipation vary widely. It is not infrequent to hear doctors saying, quite wrongly, that it does not matter if one has a bowel movement only twice a week. On the other hand, some naturopaths believe that it is normal and desirable to have up to 4 bowel movements a day. The quantity of stools passed varies from culture to culture. In rural Africa, about 400 to 500 grams of stools are passed by an adult daily. In contrast, in Western countries, an adult passes about 80 to 120 grams of stools a day. Similarly, the transit time of the stools in the bowel averages 1.5 days in rural Africa and 3 days in Western countries. Interestingly, constipation has affected Western societies for a long time. In a book entitled Human Ordure, Botanically Considered, sometimes attributed to Jonathan Swift, the author of Gulliver's Travels, are described various types of stools observed in Dublin. The 5th type of stools are those voided in small, firm, round balls, buttons, or bullets. I have observed these types to flourish mostly about colleges, schools, and most places of public education. This description fits perfectly the type of stools passed by those who suffer from constipation today. Normally, the bowel should open every day, at least once a day, and the stool should be light brown in color, roughly cylindrical in shape, and a few inches long. The main etiological factors are as follows. Irregular diet. Diet is, of course, an important cause of constipation. Excessive consumption of hot foods dries up the fluids of stomach and intestines and may cause constipation by drying up the stool so that they cannot be moved properly. Conversely, excessive consumption of cold foods may block the spleen function of transportation so that stools cannot be moved downwards. Apart from the nature of foods eaten, lack of fiber in food is a major cause of constipation in Western industrialized countries. Lack of fiber in the diet is a modern cause of disease not contemplated in the old classics of Chinese medicine, as it would not have been a problem in the times at which they were written. The importance of this factor has, however, lessened considerably over the past 10 years or so, as awareness about the importance of fiber in the diet has increased considerably. Emotional stress affects the bowel movements mostly through the liver and spleen. Emotional problems such as anger, resentment, or frustration over a long period of time may cause stagnation of liver qi. Stagnant liver qi obstructs the smooth flow of qi in the lower burner and leads to constipation and abdominal distension and pain. This is constipation of an excess nature. Excessive mental work, too much thinking, pensiveness and worrying, brooding all affect the spleen and slow down its transportation of food in the intestines, leading to constipation. This is constipation of a deficient nature and is not accompanied by distension and pain. Lack of exercise is another very important cause of constipation. Exercise stimulates the peristalsis of the large intestine, and from a Chinese perspective, lack of exercise weakens spleen qi and may also cause stagnation of liver qi. Deficient spleen qi over a long period of time fails to provide the qi to move the stools and therefore may result in constipation, while stagnant liver qi may cause it by failing to move the qi in the intestines. Overwork and childbirth. Excessive physical work weakens the spleen and injures muscles. Deficient spleen qi fails to move the stools in the large intestine and may cause constipation. The same situation may follow childbirth in women who have a pre-existing condition of spleen deficiency. Constipation after childbirth may also be caused by blood deficiency. Overwork in the sense of working long hours without adequate rest for many years weakens the kidneys. If it weakens kidney yin, it may cause constipation from dryness. If it weakens kidney yang, it may cause constipation by leading to internal cold. Febrile disease. If external wind heat is not expelled, it easily progresses to the interior and turns into interior heat, usually affecting the lungs and stomach. At this stage, corresponding to the bright yang stage of the 6 stages or qi level of the 4 levels, there is a high fever and pronounced symptoms of heat, such as intense thirst, profuse sweating, red tongue, and a rapid pulse. This type of heat during a febrile disease tends to injure fluids very quickly and cause dryness. This affects lungs, stomach, and intestines, where it dries up the stools and causes constipation. Heat that causes dryness and constipation during a febrile disease is called fire. Constipation with abdominal pain and pronounced dryness are important symptoms which distinguish fire from heat. It is for this reason that at this stage of a febrile disease with constipation or merely with dry stools, the treatment principle is to drain fire by moving downwards. Fire is drained by using bitter cold herbs. Thank you for your attention.